Ever done something impulsively and regretted it later? Like snapping at someone without thinking or making an unplanned purchase? Have you felt that urge that's hard to resist? Or seen someone repeat the same mistakes over, even when they know it's wrong? Could there be a reason behind it? If these questions are swirling in your mind, you're in the right place. Today, in this video, we'll discuss a topic that may be unfamiliar to many, but its impact on our lives or those close to us can be profound. I know you already guessed the topics. Yes, you are guessing right. We're talking about impulsive control disorders. Let's break it down into many parts so you can understand it properly. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. So, let's start with the first point and understand each one in detail. The first question that comes up is, what is this impulsive control disorder? It's a simple fact that sometimes some people feel an urge to do strange things without thinking about the consequences, like picking up unnecessary items, spending a lot of money without reason, or eating without being hungry. In such situations, they don't feel like stopping themselves. They just keep doing it. This is what we call impulsive control disorders. In simple words, when we can't control our actions and do things without thinking, we refer to that situation as impulsive control disorders. So friends, now you might have a slight idea of what impulsive control disorders are. Now let's move to the next point. All right, now let's talk about its types. What are the different faces of impulsive control disorders? Let's understand some of them one by one. So let's start with kleptomania. Kleptomania is a disorder where people feel compelled to steal things they don't need. This stealing doesn't benefit them, but they can't stop, creating problems for themselves and others. Next, intermittent explosive disorder. Intermittent explosive disorder is a condition where a person suddenly shows extreme anger or violent behavior without a significant cause. This level of anger can harm others or themselves and often leads to problems among people. Next, attention deficit hyperactivity disorder, ADHD. While ADHD is primarily characterized by symptoms of inattention, hyperactivity, and impulsivity, impulsivity is a key feature of the disorder. Next, pyromania. Pyromania is characterized by the recurrent urge to set fires deliberately. Individuals with pyromania experience tension or arousal before setting fires and may feel pleasure, gratification, or relief during or after the act. Next, antisocial personality disorder, ASPD, a mental condition in which a person has a long-term pattern of manipulating, exploiting, or violating the rights of others. So, those were some types of impulsive control disorders. Each has its own color, but what's common in all is the lack of control. Now let's talk about its symptoms. How will you know if someone has impulsive control disorders? Pay attention. I'll tell you in some points. Let's begin with sudden decision-making. Making big decisions without thinking, like suddenly going somewhere without a plan or buying something expensive without a budget. Next, feeling regret, feeling bad, immediately or sometime after doing something. Thinking, why did I do this? Next, lack of control. Not being able to control oneself no matter how hard you try, like feeling hungry and eating, or shopping impulsively, or speaking rudely to someone for no reason. Next, feeling guilty. Feeling guilty for what you did, but still not being able to stop it. Next, relationship problems. Problems in family or friendship relationships due to these behaviors. People can't understand why all this is happening. Next, financial issues. Loss of money because impulsive actions often cost a lot, like gambling or impulsive shopping. Next, mood swings. Quickly changing moods from happy to sad or angry is also a common symptom. So, friends, if you or someone around you shows these symptoms, understand that it may be a case of impulsive control disorders. And yes, it doesn't mean rushing to the doctor for every little impulsivity, but yes, if these habits are happening frequently and are out of control, then seeking help is necessary. So now let's talk about why these impulsive control disorders occur. What are the reasons behind them? This problem doesn't arise suddenly or just because of one reason. Often various factors come together to give rise to it. Let's understand in simple language. Let's start with brain game. First and foremost, our brain plays a significant role. Some chemicals that control our mood and decisions, if their balance is disturbed, it leads to impulse control problems. Like dopamine, which is the happiness chemical, if its level fluctuates, impulsivity increases. Next, genetics. Sometimes this disorder comes from genes too. If someone in the family has had this problem before, then there are chances that you might also have it. Next, childhood traumas. If someone had to face a major problem or trauma in childhood, its impact can also manifest as impulsivity later on. Next, learned behavior. Sometimes what we see or learn also shapes our habits. If impulsivity has been observed or learned since childhood, that can also be a reason. Next, mental health issues. And yes, other mental health issues like anxiety or depression can also exacerbate impulsivity. So, friends, these were some of the reasons that could contribute to impulsive control disorders. But remember, every person is different, and everyone's experience is unique. So if you or someone you know feels something like this, seeking professional help without hesitation is essential. Now comes the most crucial question: how to prevent impulsive control disorders. It's difficult to prevent any illness altogether, but yes, there are some ways to reduce the chances of it happening. Let's understand some simple tips. Let's start with adopt a healthy lifestyle. The first step is towards a healthy lifestyle, meaning good sleep, a balanced diet, and regular exercise. These keep your mind fresh and balanced. Next, reduce stress. Stress or tension can be a major problem for us. So, learn to manage stress, like through meditation, yoga, or spending time on hobbies. Next, pay attention to your emotions. Sometimes we ignore our emotions, which can create big problems later on. Understand and express your feelings, and if needed, share them with family or friends. Next, seek professional help. If you feel like there's a problem with impulse control, don't hesitate to seek professional help. Psychologists or psychiatrists can assist you with this. Next, awareness. Educate yourself and others about mental health. The more we understand, the better we can manage. These were some ways we can try to prevent impulsive control disorders from happening, but remember, if the situation is out of control, seeking professional help is the best option. All right, now let's talk about how impulsive control disorders are diagnosed. This diagnosis isn't a straightforward process because every individual is different. Doctors use various techniques. So, understand how this assessment is done. Let's begin with interview. The first step is a detailed interview. The doctor talks to you or your family members about your daily life, behavior, and emotions. This helps in understanding if there's really an issue with impulse control. Next, medical history. Then, your complete medical history is reviewed. This means checking if there were any pre-existing illnesses or conditions that could be triggering this impulsivity. Next, psychological evaluation. In this, some psychological tests are conducted, such as questionnaires or tasks, which measure your thought process, emotional state, and behavior patterns. Next, exclusion of other conditions. Sometimes impulsivity could be a side effect of another illness or condition. So, doctors also check if impulsivity could be caused by something else, like ADHD or bipolar disorder. Next, physical examination. Sometimes a physical examination is also conducted to identify any physical health issues that may be affecting impulsivity. So, friends, this was a basic framework for diagnosing impulsive control disorders. But remember, every individual is unique, and therefore treatment is also personalized. If you feel like you or someone you know is experiencing these symptoms, please don't hesitate and seek professional help. Now let's talk about the most crucial question. How is impulsive control disorders treated? Friends, its treatment is possible, but remember, patience and consistency are key. Let's see some common treatment options. Let's begin with therapy. When it comes to therapy, mainly there are two types. First, cognitive behavioral therapy, CBT. In this therapy, you're trained to understand your thoughts and behaviors and to change them in a positive way. Second, dialectical behavior therapy, DBT. This is another type of therapy designed specifically to improve impulse control. It teaches emotional regulation and stress management techniques. Next, self-help groups. You can also get support from self-help or support groups. Here you can meet people facing similar challenges and support each other. Next, lifestyle changes. By making some changes in your daily routine, you can also bring improvement in impulse control, like regular exercise, a healthy diet, and getting enough sleep. Next, mindfulness and meditation. Practices focusing on the present moment, like mindfulness, and meditation can be very helpful in impulse control. They help you understand and manage your thoughts and feelings better. Next, professional help. And most importantly, if you feel like the situation is out of control, please don't hesitate to seek professional help. A qualified psychologist or psychiatrist can guide you in the right direction. So, friends, the treatment of impulsive control disorders involves a multi-dimensional approach. It's important to have the courage and patience to follow whichever path feels right for you. And always remember, you're not alone. There's always someone available for help. So, friends, today we've learned a lot about impulsive control disorders. We've seen what it is, what types it has, what symptoms can occur, what causes it, how it's diagnosed, and most importantly, how it can be treated. The most important thing we understand from this discussion is that impulsive control disorders are a serious issue, but treatment is possible. Understanding impulsive control disorders and being aware of them is essential for our society. Not only can we help ourselves lead better and happier lives, but we can also assist those around us. Friends, thank you for watching this video. If you found this video helpful, please share it. And if you haven't subscribed to the channel yet, please do so that you can keep receiving such informative videos. Take care and stay healthy. Thank you.